At the Monday briefing from his office, Governor Cuomo released the state statistics on the coronavirus and addressed the potential impact of two occurrences on the public health crisis: the lifting of the pandemic-related restrictions and the protests that have seen massive gatherings of people who do not follow social distancing measures. Mr. Cuomo confirmed that all regions are beginning to open in accordance with a phased planning, and the city is still on track to reopen on June 8th. In response to protests against police brutality, Governor Cuomo said that he supports the need for social justice and reform, denouncing the historic roots of racism, but he also voiced frustration that the massive gatherings are undercutting the efforts to control the spread of the coronavirus infections in the state that experienced the highest number of hospitalizations, infection cases, and deaths in the country. We will not know the impact of these gatherings for a few weeks now, said Mr. Cuomo. He condemned the looting and destruction by, quote, outsiders and individuals with personal motives, end quote, while being resolute in his position that acts of violence hurt the message of injustice and discrimination. In making a point for turning a moment into a movement, Governor listed previous times that called for change, such as public housing, equal pay, gender inequalities, and gun laws. He said that this is the time to rally in a smart way by presenting an agenda or a plan to the government officials and politicians. During the questions and answers segment, I followed up on the inquiry of the medical data for the Albanian American community, specifically the number of death cases in the state, and here's the response. So follow up on the Friday briefing, you said that we don't have a public hospital system, and then you announced the surge and flex approach. If you can elaborate that, since we have the commissioner here, and also a follow-up on the community, Albanian American community is interested in the medical data, more specifically the death number of Albanians in the state. If you have that, I'd appreciate it.
Yes, you did say that Friday. Did we get that number yet?
So it's actually not broken out that way. The way the hospitals report, they report Caucasian, African American, Hispanic, Asian, and other. What we've asked the health department to do, following your question on Friday, is if there's a way to go back and discuss with the specific hospitals and see if there's a way to break down that number further, and we're working on that right now.
In terms of the hospitals, people didn't. This is one of the lessons, right? Lessons learned from this terrible situation. Our public health system, we all talk about a public health system. Yeah, except there really is no public health system. Where is the public health system? Well, the hospitals. Hospitals are not a public health system. The mayor talks about a public health system because there is a system called H&H, Health and Hospitals, which are 11 hospitals in New York City. Those are 11 public hospitals that the city runs. Though the 11 hospitals that the mayor controls are nowhere near the ability to manage a health problem in the city. There are 100 hospitals in the New York City area, but they're private, and they've never really worked together. You know, NYU Langone is one hospital, Columbia Presbyterian is another hospital, Northwell is another hospital, and they're separate hospitals. They don't share patients, they don't share material, they don't share resources, they're separate individual hospitals. What we were forced to do, because when you have a public health crisis, let's say New York City, you can't just say to those 11 hospitals, you handle it. Those 11 hospitals are battling every day just to deal with what they deal with. The first crisis we had was at Elmhurst, which was one of the public hospitals. We need those 100 private hospitals. Now, they're technically regulated by the state, but the state has never said to those private hospitals, I need you to respond to a public crisis, and I need you to allow us to coordinate operation of your hospital. That never happened before. We instituted that immediately in the middle of this situation, after we saw some hospitals getting overwhelmed, right? Elmhurst gets overwhelmed as a hospital. All right, Elmhurst. First, there are 10 other public hospitals. How do we distribute patients among those 10 publics? And if the publics can't handle it, because there's only 11, then we have to figure out how to get these 100 privates to actually operate as a system. That's what we call surge and flex. First, I said to all of them, you all have to increase your capacity 50%. They said, what? I said, yes. You have to increase your capacity 50%. You have 100 hospital beds, you have to have 150. That was the surge. And then we increased the capacity. Then we said to them, and by the way, when one of you gets overwhelmed, or one of you doesn't have the staff, or one of you doesn't have the PPE, or one of you doesn't have enough reagents, we're going to share among and coordinate among all 100 private hospitals. And by the way, those 11 publics also. That had never been done before. And when you talk about a worst case scenario is you exceed your hospital capacity. What is your hospital capacity? Your hospital capacity is theoretically, if you maximize all 100 hospitals and shifted the patient burden so they were all at 100%. And every hospital was at 100% capacity. That's your maximum capacity. That had never been thought of. And that's what we developed during the coronavirus, but we did it very quickly, and we're now codifying that and refining that. Because it's also very disruptive to the private hospitals.
Governor Cuomo announced that his meeting with Mayor de Blasio aims to discuss the handling of protests by police and calling for a curfew in the city. Rafaela Prifti reporting from the governor's office.